Welcome back. President Trump rolling out his great health care plan last week, calling on Congress to lower costs, drug prices, and insurance premiums. It also involves holding big insurance companies accountable and maximizing price transparency. It's now up to Congress to pass the plan, with more hurdles expected along the way. Joining me now here in Davos is Medicare and Medicaid Services Administrator, Dr. Mehmet Oz, with me now. Dr. Oz, great to see you.
It's always good to see you.
Thank you so much
I
for
like
being
the backdrop.
here.
It looks real.
It's such a gorgeous backdrop. It is real. It doesn't look real. That's how beautiful it is. But tell us about most favored nation status, the president's plans in terms of getting prices for health care and medications down.
So the Great Healthcare Plan, the code name for this endeavor, which we rolled out last week, is built around the chassis of the most favored nation drug pricing agreements we've already made at CMS. So the president, even in the last term, was very upset at the fact and the reality that we pay 3 times more on average for the same drugs made in the same factories, often in America, but in the same bottles. In America, we pay 3 times more than they buy them for here in Europe. So he said, we got to fix that. He charged us with that. Great team, Chris Klump, John Brooks, and Hernandez. I mean, real people, expertise came in the government. They're not normally in government, but they understand the drug companies, they understand drug pricing, and they went head-to-head with these guys. And we're able to get concessions that allowed us to get most favored drug pricing for 16 out of the 17 companies that we've originally approached, and I think we'll get them all. The president wants to codify that. He wants to make sure that these companies don't change their minds after this administration's over. We also want to make sure it's solid so it doesn't go any further, because we don't want to hurt innovation. We want to keep the industry strong. They've been rewarded by doing these arrangements to maintain their market caps across major indices. And so we feel like we've done a pretty good job. The president's going to speak about that here in about an hour. And he's going to tell European countries something that's very important for their people to hear. The governments know it, but the people don't. It takes years to get medications released in America because we're paying for the development and we're paying the appropriate amount of money for these products. It takes years to get those products into the European markets, which means Europeans often don't get access to the best medications. So some of the cancers that are suffered by humans all over the planet get better treatment in America, and Europeans don't get access to those treatments, so they die earlier if they have those problems. So if there's transparency about that, the Europeans will begin to react more favorably, and they already have started by saying, just like NATO was made stronger by Europeans contributing a given amount more than they were towards its mutual defense, you have threats from inside of our bodies, not just from outside of our bodies. Disease kills all Americans. It kills all humans at an equal rate if we don't take advances like offered by the drug companies and begin to apply them.
So what was the issue? There's just too many middlemen? Because I know the pharmaceutical benefit managers, everybody wants a stake. How is it possible that we are paying such different prices for drugs all the time?
Yeah. We have middlemen, and they're part of the issue. But the fundamental reality, Maria, if you look the pharma executives in the eyes, and we did that, they say, we knew you'd come one day. They charged more because they were allowed to charge more because no one stopped them from charging more. Listen, it's business. It's capitalism. If you can get more money for a product that others don't pay for as much, you'll take it. And we, as Americans, were willing to put that money up. The president said, no mas. We're not going to do that anymore. And he was able, just through the sheer force of power of convening, his ability to convince people that he's serious about this stuff, to get pharma companies, by the way, led by good people who went into the business often for the right reasons. They may have lost their way, but they're willing to come back and be the good people they used to be and give us the prices that they feel are fair. And we like that model. We want to try to replicate that in other parts of the health sector to drive the actual cost of care down and make it more affordable for the American people. Again, this is not throwing money at the problem. That's why we don't want to toss money at more insurance. We want to get more for the money we're already spending for our insurance.
And you've talked for years about getting ahead of disease as well, and longevity, and making sure that you stop yourself before you're actually getting sick. That's also a very cost-effective way to do it.
That's the foundation of the MAHA movement. Make it easy to be healthy. And if you do that, we'll harvest benefits. Maria, I'll give you a number that's going to blow your mind, because a lot of people watching this segment are thinking, oh, we're talking about healthcare expenses. This is about the value to the U.S. economy if we get this right. If we can get the average person watching to work one more year in their whole lifetime, just stay in your workplace for one more year, that is worth about $3 trillion to the U.S. GDP.
Wow.
That's the productivity we would unleash of people feeling they have agency over their future, like they've got stuff they want to accomplish with their lives. If you're sick, you can't work. So keep people healthy. They'll want to work. They'll want to produce, not just for 1 year, but many more. But for $3 trillion, it's worth the investment to get that return.
I love it. That is a great stat. Doctor, you've been on the ground in Minnesota. I want to get your take on what you saw there. You were visiting sites where alleged fraud has been reported. You say federal Medicaid fraud is worse than you even expected. You wrote on X, in October, we flagged $1.3 billion in Medicaid funds that 6 states may have unlawfully spent on health care for illegal immigrants. Since then, we've gathered more data, and the total has grown to over $1.8 billion across 8 states. You're also putting California on notice for the same thing, calling it the worst offender. CMS now withholding more than $300 million from the state. How is this possible?
They were getting away with it. And there's a new sheriff in town. The president's not going to tolerate this. They were literally taking people who are illegal immigrants, giving them full dental, full vision, full hearing, but we don't give that to you on Medicare, right? These are Medicaid patients who actually cannot buy their own insurance. We're giving them free health care that's worth tens of thousands of dollars, which, of course, they're not going to go back home if they're then getting that kind of benefit. And California and their governor, Newsom, was saying, well, you guys are mad. You're mean people. You're bad people. So we said, you know what? Here's the deal. You want to pay for it? You pay for it. We're not going to pay for it. The American taxpayer should not be on the hook for your largesse. Why are people in New Mexico, which is a relatively poor state compared to California, why are they paying extra federal taxes so we can push it back into taxpayers in Los Angeles? It's not right. So we stopped paying. They kept charging us, even though they weren't allowed to. It's illegal. That's the $1.8 billion we're talking about. That's, by the way, that's not even an argument. They're paying us back. We're getting that money back. But there's much, much more than that. I was in Los Angeles last week talking to whistleblowers and consumer groups. We think there's $3.5 to $4 billion more just from fraud on home health care and hospice. Now, hospice, remember, designed for end of life. You're going to die within 6 months. You have the ability to take care of yourself differently, and we think it's a mature, good system. They have increased in California the number of hospice centers 7-fold. They're not 7 times more people dying.
Wow.
And the survival rate, again, this is designed for people dying of cancer originally. The survival rate for hospice in California, if you're one of these fraudulent centers, is 100%. No one's dying. I mean, there's a higher death rate on this set here in Davos.
Unbelievable.
Everyone lives. And so we obviously are going to go after that. We're going to go after the home health care problem, where 10% roughly of the entire country spend is happening there. We're very frustrated about what's going on in Minnesota, where we're not getting a good response. We're writing letters thoughtfully to the governor, Walsh, who's not responded personally, but his agency responded in a way that we did not think was adequate. They're telling us that their state laws don't allow certain types of integrity programs, like you can't fingerprint people providing services. Well, I mean, that's your problem. The federal government has a right to audit money that we're giving you to spend for the well-being of our most vulnerable citizens. Wow. And what we're not able to get through their heads is we're doing this because we care about our vulnerable citizens. Yeah. If you make every child in the neighborhood autistic on paper so they all get health benefits, the kids who truly have autism get nothing.
Wow.
It gets diluted.
What an embarrassment that former presidents and administrations have not identified this fraud. And President Trump comes in with you and your colleagues to identify this after all these years. I want to get your take on this. New CMS data showing roughly 1.4 million fewer Americans have signed up for Obamacare health plans compared to last year. Premiums spiking after those subsidies expired on December 31st. I know, is this impacting Medicare and Medicaid right now in terms of the enrollment?
Doesn't affect Medicare and Medicaid. This is primarily about the number of people who are moving past Medicaid, getting into the workforce. The exchanges aren't for most Americans. It's just for a very select group of people making between 1 and 4 times the poverty level. That number you just gave is fascinating. The estimates from all the experts was that there would be 7-8 million people would lose their insurance. That's not what happened. We took 1.5 million people off the rolls because they didn't deserve to be on the program. They either weren't U.S. citizens or they weren't appropriately enrolled because they're making too much money for these programs. And despite that, we actually haven't seen a meaningful drop in number of people enrolled. It's about the same number. And so we're not seeing whole-scale departure. You know why, Maria? The baseline subsidy for the exchanges is 83%, which means the federal taxpayer is already putting in 83% of the money. We're just not paying 100% of the money. So the 83%, if you're going out to eat and I'm going to pay 83%, you'll still eat, right? So that's why I think, although I treasure these programs, we want to be smart and wise about how we use taxpayer dollars. Yeah. You know, we don't want to throw extra money towards insurance insurance companies, give it to the people, which is what the president has said, and also drive the overall price down, which is, again, what most favored nation drug pricing, which we're talking about here in Davos, is about. But it's so much more. And I think the number one thing we're going to make savings for all people on, in addition to cutting out fraud, waste, and abuse, is to digitize healthcare in a way that we can make a tech transformation happen.
I could imagine that would be saving a lot of money as well.
Why not bring the rest of the health economy to keep up with Netflix and Uber and your bank? I mean, all the technologies that have been used to make those parts of your life cheaper, deflationary, those same technologies haven't been applied to healthcare. So healthcare gets expensive, despite the fact that there are tools available to naturally make it more efficient and drive down costs.
It's a great point. You look at all those files in your doctor's office. Real quick before you go on the GLP-1 drugs, because we've seen such success. I just ran into Stefan from Moderna. What's your take on those drugs? Because there's all these reports, and it's not just about obesity, but those drugs actually are having favorable impact on things like dementia, on things like heart disease. Do you agree with that?
I do agree that these drugs are just starting off. They're going to reduce obesity, which is driving maybe half of total healthcare spend, because of downstream impact from hypertension and diabetes, and because of that heart disease and dementia and liver problems and kidney failure. But these drugs also have a benefit on general behavior, like addiction. They're going to help people in ways we don't even anticipate. Now we have pills that are coming out.
Yes.
And the president has made these drugs affordable for the first time.
Right.
And again, folks often say, does the president connecting with me? He's going to help us lose 100 million pounds this year. Why? Because he's going to make these drugs affordable. So we already have the deals with Novo Nordisk and with Lilly. Trump RX, which is fantastic, is going to launch with those drugs soon. And you're going to see everybody in America being able to access drugs at a fraction of what they used to cost, so that they'll start taking this. And here's the best news.
Yep.
Within 2 years from today, we believe we'll actually save taxpayer dollars, so that these will pay for themselves, because it's going to reduce expenses so much that we're not going to be spending money on open heart surgery and kidney dialysis. Yeah. And that's actually going to make more people want to work longer, and that's the $3 trillion payoff that we anticipate.
That's what I'm saying, getting ahead of disease, which is so critical. Dr. Oz, great to talk to you. Thank you so much.
With you.
I love talking to you.
And I like what you did with the place.
It's so gorgeous. He's right. It looks fake. Dr. Mehmet Oz here in Davos with me. We'll be right back. You're watching Mornings with Maria, live on Fox Business from the World Economic Forum in Davos.